Hi, I'm Joslyn Kirby. This is my point of view on one of the Skin articles entitled Perspectives on Pediatric Hidradenitis Suppurativa, a Survey of Pediatric Providers. This was put together by a great team of investigators from California, Arkansas, and North Carolina. And I think it gives us a little bit of perspective on what's happening on the other side of that patient we're seeing in clinic, the other side where they were referred from a pediatric provider. And so this survey showed that about 50% of pediatric providers said they were seeing and diagnosing HS. The vast majority, when they did see it, were also screening for important comorbidities like obesity, mental health, cardiovascular risk factors, and PCOS, though they were less likely to look for inflammatory bowel disease. And more than 80% were prescribing either topical or oral antibiotics as treatments, though they were less likely to prescribe things like spironolactone or perform procedures like an incision and drainage or intralesional triamcinolone. So how's this help me? Well, from my point of view, I think that we have an opportunity to help the other 50% of the pediatric providers see the HS that is probably seeing them in their clinic, to help expand the comorbidities to the most frequent ones, and that includes inflammatory bowel disease, and to help engage with them on first-line therapy, since there can sometimes be a wait or even difficult access to a dermatologist. But also keeping in mind the incredible strength of our pediatric provider colleagues, which is to screen and look for those comorbidities. And I think together we can really take care of these patients.